The Heroes for Gender Transformative Action is a health program in high-burden districts of Uganda and is a joint district-based program that is implemented by the consortium of Amref Health Africa in Uganda, Cordaid, Mifumi, and the International Center for Research on Women, ICRW, with the aim of improving the well-being of young people, women, and the underserved groups in Central Region. The Heroes program works with and through various stakeholders at the districts to ensure sustainability, ownership, and local government and community involvement. In Kalangala district, the program successfully got the local government's buy-in through signing of a memorandum of understanding that will be in action until 2024.
Samswa sub-county as large has many problems, has many issues regarding the young children. We had early marriages and HIV/AIDS is high, high school dropouts, and children-headed families.
Under health systems strengthening, the program has built capacity of the district health management teams and the health unit management committees to enhance service delivery using an integration model that also includes SGBV management at the health facilities.
To train the local leaders, we have 40 local leaders who have been trained in how to handle SGBV. Of course, also they have been trained on to deal with bad practices or bad norms which escalate SGBV in our communities.
So, because of these projects, I can say the cases have gone lowering down because now children and women can easily report some of the experiences they go through concerning violating their rights.
Under Objective 3 and 4, we have referral pathways. And referral pathways are mainly how survivors can seek justice in the community and also those that are set up by the government. So we have both informal and formal referral pathways. And under the formal pathways, we have the police, we have the probation officer that deals mainly with issues of children and welfare. We have courts, where the cases are always heard. So we also work with health centers. Some of the cases that we deal with include, could be on physical violence, sexual violence, and all those require forms and medical evidence to be picked. So the health workers help us to fill police form 3s that are required in collaborating evidence on sexual violence.
So during the sensitization, we are able to show the communities who are the duty bearers, who are supposed to handle these matters, who are the local leaders supposed to be the first point of contact, and then where to refer these cases to.
Over the 4 years, the program targets to enroll 1,008 peers and community resource persons, both in school and out of school. 70% of whom will be female, that will be selected using a criterion where the beneficiaries are guided to take lead.
Like right now, we are going to move around and see how we are working now with our youth-friendly corner. We had it, but it was docile. Let me say it was inactive because it was brought by the Red Cross later in like in 2016, 2015 back. But the services are deteriorated, so they were not able to uphold them and everything died. But now, when the program came, we were able to awaken the services, and now the youth-friendly corner is open.
Now, in education sector, mainly Heroes program is focused on journeys implementation, basically addressing sexual and reproductive rights for our learners. We have sessions being conducted according to the program. We have school governing bodies being facilitated, especially their meetings to discuss issues related to violation of children's rights and getting solutions to these problems. We are beginning to note their competences being developed, social and emotional competences. They are now able to make meaningful decisions in their lives. So really we are seeing this program very, very important to our schools.
In all the health facilities in Kalangala, service integration has been promoted at all the service delivery points such as OPD, PMTCT, MCH and immunization. Heroes program in Kalangala furnish all the service delivery points in the health facilities with SRHR/SGBV SOPs and guidelines, as it was evidenced in the health facility assessment that most of the service points lacked or had outdated SOPs. In addition, the integration has been promoted using the result-based financing RFB interventions at the health facilities in the district.
And so through Heroes, we are trying to address and to contribute to curbing down these issues. And as Cordaid, we strongly believe that a system transformation approach is necessary in collaboration and in complementarity of other approaches, and therefore that's why we are applying the results-based financing approach to strengthen health systems here in Kalangala district.
Mobilization is done well. The facilities, the communities respond, and we have always had a great turn-up of people coming for these services, especially when they hear about the free, comprehensive sexual and reproductive health services that we offer at the outreach site. In the outreach, we offer services related to sexual gender-based violence response and the counseling. We also offer family planning, ANC, immunization, and other sexual gender-based and sexual reproductive health services like STI screening and management to ensure that a client receives the full package of the services that we offer as a program without spending a lot on transport to reach the facilities that are far from their communities. The different islands that we work with have many islands, and the 21 outreaches that we have supported since the inception of the program, we feel it is not enough because one facility serves over 8 islands, and this needs to increase the number of outreaches that to be able to reach out to more islands with the same services that are integrated to avoid them from moving for longer distances and spending a lot of money.